Hi everyone, welcome to Medicine YouTube channel. In this video, we are going to see about cold abscess. Cold abscess is also known as tuberculosis abscess. Abscess shows no sign of acute inflammation, that is why it is known as cold abscess. It occurs most commonly in neck, groin as well as psoas region. It is mostly there is no sign of acute inflammation here, and that is why it is known as cold abscess. Area of origin. The tuberculosis lymphadenitis cold abscess is commonly seen in the anterior triangle of the neck. In tuberculosis lymphadenitis, the cold abscess is commonly seen in the anterior triangle of the neck. The tuberculosis of the cervical spine, the cold abscess occurs in the posterior triangle of the neck. Both in tuberculosis lymphadenitis, the cold abscess is commonly seen in the anterior triangle of the neck. In tuberculosis cervical spine, the cold abscess occurs in posterior triangle of the neck. In clinical features, it is more common in younger age group and it is seen at any age. There is presence of swelling over the neck which is smooth, soft, fluctuant and non-tender and non-transilluminant and have restricting mobility. There is also a presence of evening fever, loss of weight and appetite and anemia. The abscess shows no sign of acute inflammation. In this abscess, there is no sign of acute inflammation. There is metal lymph node is seen present to the adjacent cold abscess which are palpable, and it can be palpable. And these are the clinical features of the cold abscess. Now we will see the investigation. There is increased ESR, erythrocyte sedimentation rate is increased. Mountax test is positive. Presence of anemia and lymphocytosis. Chest X-ray shows pulmonary tuberculosis. FNAC and MRI is given. Sequelae. The secondary infection occurs in cold abscess and it becomes tender. The formation of sinus. The disease is spread to other lymph nodes and organ. The cholesterol abscess forms a pressure increased in the cold abscess and provide a way through deep fascia to reach the subcutaneous plane and adhere the skin. These are the sequelae of the cold abscess. Now we will see the treatment. Antitubercular drugs are given. Excision of the affected lymph nodes, which is because the lymph nodes gets mated on. So there should be excision of the affected lymph node. Cervical spine should be immobilized by the plaster and jacket for 4 months. By plaster and jacket, the cervical spine should be immobilized. The drainage using non-dependent incision and later the closure of wound without placing the drain. These are the treatment of cold abscess. That's all about the cold abscess. If you like this video, please do like, share and subscribe my YouTube channel. If you have any doubt on it, please do comment it. If you want more videos, please do subscribe.